Hi, welcome to my testimony about Emteva. My name is Dorte, I am from Denmark, and I am a product specialist and a representative for Hunter Urology. Due to an operation for cervical cancer, I had the nerves to my bladder permanently damaged. And for me, it meant that I could not pee in a normal way any longer, and I had to empty my bladder in another way. And after 10 years of chronic bladder infections, incontinence and severe decrease of my life quality, I discovered Emteva, and literally the world opened to me again. Freedom. Freedom to live my life the way I want it. There's several areas that are very important to me, and I feel free because even though I'm bound to ISC for the rest of my life, I do not experience any limitations caused by my bladder condition. I'm free to engage in any kind of activity that I want. So, you see, if going to the toilet is a constant challenge, it becomes such a huge obstacle inside you that you just avoid doing all the things you want to do, and that's really a shame, I think. Emteva has this little lid, and this little lid gives me my fundamental control back. A control that allows me either to hold or to let go, to pee or not to pee, so to speak. And there's also another thing about Emteva, and that is it is conical shaped. So once it is inside me, it stays inside me. I do not have to hold on to it. And that is really, really nice. That I do not have to have my hands down there while I do my thing. It's much more comfortable and hygienic, of course, like that. Imagine that you had to sit with your hands in a lavatory bowl, in a train or movie theater. It's just not nice. And you see, speaking of the things that I can do because of Emteva, I take it out of the bag, close the lid, and I can insert my Emteva standing up. I lean over the toilet, open the lid, and then let go without even getting near the lavatory bowl. And trust me, the other things with your hands down the bowl in a non-hygienic public toilet, that's just not nice. And then you would tend to stay at home instead of having all the problems with the toilet arrangements. And then of course there are the environmental aspect. I consider myself as a common sense, environmental aware woman. I'm not hysterical about it, but for me it is of great significance that I can choose a product that is 100% biodegradable and CO2 neutral. And Emteva is made out of cornstarch, and it really pleases me that I do not leave a mountain of plastic garbage behind me. I mean, if it is avoidable, it is preferable. Furthermore, if I, for instance, were motoric challenged in my hands, handicapped, crammed up, I could still use Emteva because of its little handle to hold on to. And also for me, that handle makes sure that I do not end up with urine on my hands. It's much more hygienic. And because of the handle and due to the stiffness, you can see Emteva is quite stiff, but it's also very flexible. But yeah, and it has this silk smooth surface. And due to the stiffness, I can actually insert my Emteva without even touching myself down there. It's nice, but it do take some practice to be able to do that. Yes, when I'm finished, I just put my Emteva back in its little bag, and I either dispose it immediately or I put it back in my own bag. And if I put it back in my own bag, there are no dripping or spilling of urine or fluids. There are no smell. And if I decide to dispose it immediately, I love that the packing is so discreet that it just looks like any other kind of a female hygienic product. It's not something you would notice. And I really do like that thought. It's gone. I only get bladder infections if I stay outside too long and I'm not properly dressed for the weather. And more important, the incontinence is gone. I just have to remember to empty my bladder. I think that sometimes less is more. And with Emteva, I have a product with minimum and very, very little intervention to my life. And I really, really do think of Emteva as a perfect solution to a minor complication. And for me, my bladder problem is now a minor complication. Beforehand, it was kind of the whole world. But now, thanks to Emteva, it's just a minor complication. And I don't think of myself as a patient. Not any more than a person with glasses would consider themselves as a patient in the optical area. I'm just a user of a product, and doing ISC with Emteva is a simple solution to a minor complication. It's not a surgical procedure. It's just another way of peeing.